My name is Heather Strobel. Today is February 28th, 2019, and I'm going to be performing medication administration through gastronomy tube. I've gathered all my supplies. I've checked my more with my physician's orders. I've got my medication and anything that I'll need. I'm going to hand hygiene and take my supplies to my room. Knock, knock, knock. Come in. Hi, my name's Heather. I'm going to be your nurse today. I've come to give you medication through your gastronomy tube. Is that okay?
It is.
Can you verify your name, your date of birth, and any allergies that you have?
Stephanie Soto, 21291, and I do not have any allergies.
Okay, just take your armband. Okay, I'm going to raise your head of the bed up
Okay.
to high balance.
Alright.
This prevents you from This will help prevent you from aspirating any of the gastric contents into your lungs.
Okay.
If I had a bigger side rail that prevented me from getting over, I would lower it. Raise the bed up to working level. Good. So I've checked my MAR with my physician's order. I'm going to be giving Lasix, Cipro, Carvedilol, and then Metformin. But Metformin is extended release, so I won't be giving that through the PEG tube.
Okay.
So you're going to get your Lasix. This is a loop diuretic. It's going to inhibit sodium from absorbing back into your system, and so that you can increase urination and pull fluid out of your body. Major side effects of this drug is renal failure and hypokalemia. So you need to check electrolyte balances, CBC, and renal function. Then you have Cipro. This is a broad spectrum antibiotic. They're giving it to you to clear out any infection that you might have. So, two side effects may be angioedema from anaphylaxis and immunosuppression or bone marrow depression. And Carvedilol, that's an antihypertensive. So I would check your blood pressure and your heart rate. Shouldn't be given if your heart rate is below 60 and your blood pressure is below 90 on diastolic. And yeah, this blocks the adrenaline's adrenergic blocker, so it blocks adrenaline from crossing the cell membrane, relaxing smooth muscles so that it decreases your blood pressure by vasodilation and may even lower your heart rate. I'm going to wash my hands, hand hygiene, use this hand sanitizer stuff. Okay. Before I touch the patient, put my gloves on. I'm just going to get started here, okay? I'm going to expose the area of the tube. Place a towel around it. Keeps linen and clothing from getting wet. Inspect the tube and the area around the tube. Noticing the mark on the outside, maybe to notice how long or if it's been pulled out any. Okay. Before I get started, I'm just going to listen to some vowel sounds in all 4 quadrants. Okay, your vowel sounds sound good. Okay. And this should not be painful or even uncomfortable. If it is, you stop me anytime if you have any questions. Hopefully I'll be able to answer them for you. So now I'm just going to check your gag reflex. Can you stick your tongue out for me? Thank you. Sorry about that. Never liked that when I went to the doctor either.
That's okay.
Okay, so I've got my medication here. I've got my Lasix, my Cipro, and Carvedilol. These all can be crushed. I've checked my physician's order for the amount of water that I will flush each medicine with, and that to be 10 milliliters. So I'm just going to go ahead and get my cups with some water in it, 10 milliliters in each one. Okay, so need about 10 milliliters to flush before and after. So I checked each medication, the amount of medication, make sure I have my right patient, assess their allergies, all this done before I give it, that they can be crushed. So I'm going to go ahead and start with my Lasix. Just going to mix that up. Okay. Now Cipro. Before giving the Lasix, I would check the blood pressure and heart rate. Eyes and nose need to be done daily weights. And Carvedilol, blood pressure as well. Okay, so got all these medications mixed up. I'm going to give them one at a time. Okay, we're going to get started. Do you have any questions?
I don't.
Okay, so I'm just going to clamp the tube off, place my syringe. I'm going to withdraw gastric contents. I've only got about 30 cc's. If I get more than 150, you need to put it back and hold the medication. So, go ahead and close that up. Okay. I'm going to test my stomach contents. pH should be below 5, and it is. Make sure that I'm in the stomach, and I'm going to go ahead and aspirate them back. Wrong step. Back up. Going to take my syringe apart and place it in the tube. And I'm going to pour the stomach contents back in and let gravity take it. Before air gets in, you need to clamp the tube. Go ahead and flush with 10 milliliters of water. Gravity take it. Not too fast. Break the tube off before it gets below so that no air gets into the stomach. I already did the water, right? Yeah. Okay, and we'll do my first medication. Bring it in. Gravity take it. Flush with 10 cc's more water. This is the Cipro. Miss Stephanie, are you feeling okay?
I am. Thank you.
This is the last medication I heard about. Okay, that was the last medication, so I'm just going to flush with 10 cc's of water. Wipe it off before you allow air into the tube. Pull your syringe out. Go ahead and clean up any remaining water that you've not spilled. Noting again the appearance of the side. Does your patient ask them, feeling okay? I can go ahead and listen to bowel sounds again. Okay, Miss Stephanie, everything sounds good.
Okay.
So, do you have any questions or any needs?
I don't.
Okay. Well, I'm just going to lay you back at semi-Fowler's, okay? We want to keep your head up all the time to prevent any gastric contents from going down into your lung. Aspiration is what they call it. Are you comfortable?
Yes, ma'am.
Okay, I'm just going to go ahead and put your bed down and hand hygiene. Give you your call out bag. If you need anything, you can call.
Okay.
And I would have done one more thing that I didn't think about is I would, how I gave my medicines. I would probably go ahead and give the heart medication first, the Lasix second, and then I would worry about the Cipro. That's down. Patient's going to fall out of bed again. Okay. This concludes my medication administration.